And it sounds like some of you already have experienced what it's like to not be able to breathe at night, but we're going to start with this video. It says when sleeping becomes tiring, and then we'll start in with the presentation. Yeah. And you made the comment that you could see his stomach still moving like he was breathing, but you didn't hear any air going out, in and out. With sleep apnea, that is a very common problem if it's truly obstructive. So you'll see their stomach move, but there actually is no air going in or out. I sleep with someone that sleeps like that every night. So literally, it makes it a big challenge for the spouse, not only for dealing with that, but for the patient as well. Okay, obstructive sleep apnea. What is it? It is a condition when you can stop breathing or you start breathing really, really shallowly. And sometimes it will happen many times during the night, sometimes it's only a few. When you're first starting in with it, it's only a few times during the night, and you'll kind of rouse up and you'll be like, oh, what startled me awake? And then you'll roll back over and go to sleep. But it's something that literally has built up over years. So you'll have patients that when they first go in and they're having other things going on and they're trying to figure out health-wise what's going on, like when they look at your blood work, they can look and see, for instance, if your red blood count is higher than normal, you actually produce more red blood cells because you're having problems with not getting enough oxygen at night. So your body's trying to compensate by giving you a few more red blood cells in order to carry the oxygen that you're actually getting. So they'll look at that and say, well, maybe we have a few other issues going on. And the other thing is they suggest when you do go in to talk to your doctor, you talk about the 3 S's. The 3 S's meaning, do you snore? And just because you snore doesn't mean that you actually have sleep apnea. I have a situation at my house. I have a grandma that has snored for years. She'll be 95 in October. And she literally sounds like she's cutting down the forest every night. And it's because she had throat surgery because of cancer, and because the tissue's a lot looser, she can snore. My mom, on the other hand, had been hit by my nephew when he was little because he was goofing off and during family prayers reared back with his head and whumped her hard and broke the soft palate in her mouth. And so now when she snores, we really know the forest is being cut down, but you also know when she stops breathing because then all of a sudden it's quiet in the house. Then with my husband, because he's diabetic, which is one of the precursors a lot of times, is they get a lot of belly weight and they get other issues going on, that they literally start having the issues where they quit breathing and you have someone roll over and elbow them and say, roll over, you're not breathing right. So some of those things are what you find going on. So with the risk factors, a lot of times people don't realize it, but you'll have a family history of it. If you know that grandma and grandpa had sleep problems, either they just had a hard time sleeping, or you know that they snored really bad, and it's like, well, you know, grandma and grandpa snore, dad snores, and I keep getting told I snore. Maybe I need to check into it. Especially if you find that when you wake up, you're still really tired. Another thing is a lot of times you'll have people that they may not be really heavy, but they have an abnormality in like their facial structure or in the back of their throat, which makes it so that their airway is a lot smaller. And then sometimes, just due to that simple fact, they have problems with having their airway go closed at night. Sometimes with them, getting a bed that positions a little differently so that they're not sleeping flat will help, or there are devices that you can use. Other things that are non-structural are kind of in society today is you have the obesity problem. We have a lot of problems with people that they put their weight right here on their belly. And yeah, you get a little round tummy here. And it puts a lot of pressure up on the diaphragm at night, and so it makes it so you don't breathe as deep. Sometimes it makes it so that if you obstruct up in your throat and you have an extra weight here, it makes it so you're not getting enough oxygen. And a lot of times, they also get the round, thick neck. The more weight you have in your neck or up into your throat, the harder it is for your airway to stay open. Because as you get older, your muscles get a little weaker, and your brain can't always tell them to keep your airway open because they just get soft and they're saying, I don't have to. Another one of those non-structural things is just being a man. Unfortunately, men get the bad deal on that one. And then age. The older you get, the more likely that tissue back there in the back of your throat just gets soft. For women, we catch up after we go through our menopause and we become postmenopausal. So a lot of times, ladies make it through just fine. They will, some of them, experience it while they're pregnant, just because they get so big that there's just no room to breathe. People that use a lot of alcohol at night tend to have problems because they sedate themselves. So then the tissues are really soft and flabby, and they also tend to have a little bit more problems with stuff coming up and aggravating their throat. Sedative use. If you have to use a sleep time agent to put yourself to sleep, something that, you know, Tylenol PM, sometimes we even have to get a prescription to help us be able to sleep. Sometimes using that actually makes us a little more susceptible to developing sleep apnea. Smoking. If you smoke or even use an e-cig, those vapors are very irritating to the back of your throat. It keeps an extra inflammation in there, which makes the tissues a little more swollen, and you tend to have a few more problems at night. If you happen to be a daytime snorer, like you feel like you have to have a nap, or you fall asleep at your desk while you're at work, you know, you need a 15, 20-minute cat nap, or my husband does this when we're driving, we're sitting at a stoplight too long, he can start to snore. So you know you've got a few problems you need to deal with. And if you tend to be a back sleeper, if you like to sleep on your back and you like to lay flat, it just puts you a lot more prone to be able to have those muscles relax and just let everything, your tongue and all the soft tissues in your mouth fall backwards. Okay, so basically we have symptoms that we look for. When you're going in and talking to your doctor about general health things that are going on, you'll recognize some of these that are starting to go on in your life, and sometimes you're like, yeah, I don't want to have to deal with it, but maybe I ought to. Is you start to snore. And it's more your spouse that will complain about it, or even your kids that are in the other room. My kids, when they're up late doing homework, will go, oh my gosh, what did you do to Dad last night? He snored horribly. I'm like, well, I couldn't get him to roll over. So you'll know that there's some issues going on there. That gasping, like you saw in the video, that gasping, choking, they sit up and they're like, because they feel like they literally are not getting enough air, because they aren't, and they're fighting to get the air. And after they've done that, a lot of times they have a hard time going back to sleep. And so then they toss and they turn and they're restless. And it makes it so they feel like, oh, what was the point of going to bed? The nocturia, meaning you have to get up and go to the bathroom a lot. That's one of your body's responses to the fact that you need to breathe. If it makes you have to pee, you have to get up, you're going to wake up, then you're going to be so that you're getting the oxygen you need, but you're not getting the rest you need. And insomnia, well, you're just restless. You can't go to sleep. Once you get to sleep, you can't stay asleep. You toss, you turn, your legs thrash. All those are pretty much a good indication that there might be something going on that needs to be taken care of. In the morning when you get up, you're going to find that a lot of times you just are still tired. My husband will get up every morning, and I've been trying to convince him now for 6 months, we really need to take care of this. I'm fine. I don't need to deal with this. My daughter, who's in medical school, will say, Dad, would you please take care of this? He'll be like, okay. I'm like, really? Anyway, so you wake up, you're still really tired. You feel like you need to go back to bed for a while. A lot of times you wake up with a morning headache. It's like, oh, where's the Tylenol? My head's pounding, it hurts, your throat's dry. Sometimes it feels like you've tried sucking a whole bale of straw down your throat. And then you're just, every time you sit down, or even while you're just standing in position, you feel like you're literally falling asleep. You can go into the grocery store a lot of times and you'll see people that are struggling with it, that they literally are standing there at the cart and they're just going like this. They're not moving, but they're just standing there sound asleep. A lot of times, once it's progressed to the point it's starting to impede and you're having the daytime sleepiness, you're going to have cognitive problems. You literally don't remember what you were doing. I mean, it's bad enough when you have kids and you get up and you go to do something, you go, okay, what was I going to do? But literally, you can't remember the order of doing certain things because you've done it for years, and now you're going, I don't remember how to do this. Or else, what was I going to do? And people will be like, I told you this. And you're like, no, you didn't. You just don't remember. And sometimes you find that literally it's almost like you're starting to develop some memory issues. And if you feel like that's a problem, then you may want to talk to the doctor about it. Decreased vigilance. You're just not as aware of your surroundings. I mean, we talk about people with the headphones and stuff on as they're walking around and not paying attention. Sometimes people are just zoned into their own world enough because they're so tired, they just aren't paying attention to what's going on around them. They may walk in front of a car, which wouldn't be great, or else they do things that they really shouldn't. Morning confusion. You get up in the morning and you're just like, we've had patients that when we've gotten done with their sleep study and we'll go and say, okay, we're going to send you home, and they're like, where am I? What's going on? And so they wake up and it takes a moment, and it's almost like they have to orient to where they are and what's going on for the day. One of the biggest things you'll start seeing is you start having personality and mood changes. So if they're a happy-go-lucky person or someone that's, usually easy to get along with, they become cranky, they become irritable. You don't want to deal with them because they're just standing there, or else they just look at you and they give you the evil eye and say, go away. You start going, what's going on? And they're like, nothing, just leave me alone. So that will be a key on that. They also start having problems because if you're not sleeping, you tend to have a lot more anxiety issues. You tend to be a lot more depressed because you just don't feel like you can cope with the world. For guys in particular, you start having a lot of sexual dysfunction. They can't get an arousal, they can't get it up. Their testosterone levels tend to drop. So a lot of times they look to say, well, let's see what's going on sleep-wise. Patients that have sleep apnea, a lot of times they also have reflux issues. So if you can, a lot of times just using a pillow or an extra prop, you can get wedges, foam wedges in that to prop yourself up in bed so that you're not having that reflux, but it also helps keep your airway open. It helps quite a bit. The other thing is you'll find that your blood pressure's up. You'll go in and you've had like a health exam and they'll be like, oh, your blood pressure's higher than it's been in the past. Or you're finding that it's trending up, that maybe you need to look at something in that line that you're not sleeping well. So that what you want to do is they'll go into a doctor's office and they're going to take a look at your neck. They're going to see if it's a little thicker than it needs to be, or if you've got some extra weight on it. They'll take a look at your throat. For those of us that may still have our tonsils and adenoids, they may look to see if they're a little big for what they should be and having that extra size in there. Because I've had adults come in when we did sleep, I was doing a lot of sleep studies because their insurance refused to pay to have their tonsils out because they were over 21, but they were the size of 2 baseballs at the back of their throat. And so when they laid down, they couldn't breathe. So they had to prove that they had sleep apnea in order to get their tonsils out. It was a little crazy. But sometimes that is a problem. If you've had any like trauma or anything to your neck, or you've had surgery, you've played football, you've wrestled around, you've busted your nose and you have a deviated septum, a lot of times that puts you at more risk to developing a problem with having airway obstruction because the passageways have been a little bit compromised. They'll look at your blood pressure. Like I was telling you, the higher the blood pressure, the more apt that they are to think that you need to do that. So then they'll say, well, you have all these signs and symptoms, and if your spouse concurs that you're having some sleeping problems, then they'll look at doing what they can call an overnight oximeter test. This test is really simple. They send you home with there's 8 pages of paperwork that you fill out. It gives them basically a picture of who you are, what your health history is, and then you put a probe on your finger. It has a computer monitor that goes around your wrist. Even if you get up and down multiple times, you leave it on, and then in the morning you just take it to the sleep lab. They run it and let the pulmonologist take a look at it. Then they'll take that and they'll send the test results and the pulmonologist's interpretation of what he's saying to your family doctor, and then he'll sit down with you and say, okay, this is what's going on. At night, you're having a little bit of an issue. And if it's not really bad, he may suggest that you start adding some routine exercise, that maybe you look at losing some of that weight. Went the wrong way. So for what they'll look at for treatment is they'll suggest that you, if it's not really bad, is you look at losing that weight, because the weight in your belly and your neck will actually be causing some of the problem. Routine exercise, because high blood pressure puts you at a little more risk because it's putting more pressure onto your throat, because your blood vessels run right along your trachea and that, so it tends to cause some problems. Another thing is, if you do use alcohol, don't use it within about 3 to 4 hours before you go to bed. A lot of people like a drink before they go to sleep in order to relax so that they can sleep, but it's a lot of times too sedating, and so they suggest that you don't do that. The other thing is to quit smoking, or don't do the e-cig because it tends to make your tissues swell. I mean, e-cigs are better than cigarettes, but they just don't want you adding that inflammation to your tissues because it tends to make it have a lot of swelling issues. The other thing is if you have allergies, seasonal allergies, you'll notice people sometimes snore more in the spring or summer when their allergens that are in the air are bothering them more. They say take an allergy medicine, use a nasal spray, something to help open up those passages so that you can not be snoring and not have the obstruction going on. And the other thing is, if you're a back sleeper, you're going to have to learn to sleep in another position. And they actually say the best position for sleep apnea is to sleep on your belly, on your side or on your belly, because in your belly you actually are leaning forward so that your airway is open. If that doesn't resolve it, then they'll have you do another study where they look to see what they're going to have to do, because they can do treatments for it. They have devices. And like they were talking earlier, these 3 guys, you can wear a machine. It's called a CPAP machine. And they had it, it used to be when we did this, man, you'd have a mask that went from your forehead down to your chin. Horrible idea. Then it was to the point that literally it was a mask that went from like bridging your nose down to your chin. Now they have them so that they either fit on your nose, or you literally can have what they call a CPAP pillow that you can wear under your nose. So it's more like wearing a nasal cannula, which was a lot easier. The CPAP machines are set up after you've done the study and they've done a titration for you. The amount of airflow that you experience through those machines is literally based off of what they find it takes to keep your airways open. And there are patients, sometimes we have to put them on BiPAP, which is where the pressures fluctuate. Sometimes we can actually use a device, an oral device. You can go into your dentist and say, hey, I'm having problems. And especially if you have jaw problems, they'll put in it's almost like wearing a retainer that slides your bottom jaw forward and pushes your tongue forward so that you can breathe at night. And when all of those fail, there are actually surgical options that they can go in. If you have a deviated septum, sometimes that's all it takes is you have to go in and have no surgery to have it fixed. Or you have to have the polyps and stuff cleaned out of your sinuses. It's better than the alternative. Then if you have other issues, I mean, sometimes it becomes as severe as they have to actually do a trach for the patients to be able to breathe. Getting it treated is a major health benefit for everyone, not only for you and for your family members, but it also helps you insurance-wise, because when you start dealing with it, yeah, you deal with the daytime fatigue and sleepiness. You've come across people that you come in, it doesn't matter what time of day it is, they're always asleep at the desk, unless you touch them or bump them or wake them up. We have a clerk in the office, well, at our church, and he's funny, he sits up front, he's 532 pounds. He's a big guy. And literally as soon as we're done with the sacrament, he's asleep. And he's like, it's the best sleep I get all day long. But it's because he knows he has sleep apnea, and he's just not willing to do anything about it right now. So he's literally setting himself up for other problems. You develop cardiovascular problems. If you already know that you have a family history of heart problems where you have early heart attacks, if you have strokes, if they tend to have issues with blood clotting or anything like that, you're setting yourself up for more problems with having problems with sleep, because your body isn't able to rest and regenerate when you have sleep apnea, and so you start having more problems that way. When you have surgery or they put you on medication, say you take a pain pill, you tend to be a lot more sedated, so then you become a lot more sleepy, your apnea gets worse, you tend to have more problems that way. And if you have surgery, we put you under, and then we try waking you up afterwards. It takes a lot more sometimes, and sometimes we literally have to leave you on a ventilator for a while in order to get you woke up. Don't know that you really want that. And the one that I find interesting is you tend to develop more eye problems when you have sleep apnea and it's not corrected, because your eyes need oxygen, and oxygen usually is able to be distributed at night better through your eye, so that one, they're more rested, and two, because when you have high blood pressure, the high blood pressure comes in your eyes. And so it shuts, and it makes the blood vessels constrict in the back of your eye, where you have all of the cones and that you need for your vision. And so sometimes when it gets tight enough that you'll literally start having retinal detections, you might have a bleed. One of the guys that is one of my husband's friends, he goes in every 6 weeks and gets shots in his eyes because he has bleeds because he has sleep apnea. And it tends, if he doesn't use his mask, you know within 2 weeks that he's going to have blood pooling over here on the sides of his eyes that he's going to have taken care of. And the one that you'll hear the most complaints about is your spouse is going to be the one that complains the loudest, because they're like, you know what, I am tired of sleeping with this. And I always wondered why my grandma slept in another room from my grandpa, but I think that might have been part of it, is because my grandpa was a huge snorer on my dad's side. And so I was like, that might explain part of it. They just couldn't sleep in the same room because she didn't get any rest listening to him snore all night long. So when you're looking at that and trying to decide what's best for you, I mean, as the devices change, and it makes it much easier compared to what it used to be for treating sleep apnea, talk to your doctor, because sometimes it's not just the obstruction. Sometimes our brain forgets to tell us to breathe, and there are medications that they can give, because with kids, it's becoming a bigger problem, especially with the younger that we're able to save. The more preemie they are, we tend to have to give them medications in order for their brain to be told to make them breathe at night. So be aware that it's not just an old age problem. You'll see it throughout it. And sometimes you just have to be the one to say, hey, let's get this fixed. Do you guys have any questions for me?
How is insurance on CPAP machines?
Generally, most CPAP machines are covered by insurance. I have a friend that I work with. Her insurance actually pays for her to get new pillows once a year, and they'll just send her a year's supply. She just has to have the doctor send a letter as to why. And so after the initial setup, generally the machine is covered. You may have a copay, like an, what's it called, a device copay that you have to put down, but usually it's covered after that for all of your throwaway supplies and that. But if you have flex spending for using towards that, that's a great way to use it. That way at least you're not having to use it for, say, you know, you fallen asleep and caused a car accident, then you can't use it that way, so. Are there any other questions? He's like, no, I'm good, I'm good.
When would you suggest a dental device?
If you find, for a dental device, for sleep apnea, a lot of times if you're finding that you're just waking up with a mild headache, and it's something that you find that you're snoring, and you wake up with a dry mouth, you may have a little bit of a headache once in a while, you'll want to look at doing that, and then maybe just try adjusting your pillows. If adjusting the pillows or putting something a little more firm so that you're not flat in bed isn't doing it, then talk to your dentist about using a dental device like that. You may also want to have him just look at your mouth and see if maybe that isn't something he would suggest right now, because when he looks at the back of your throat, he can tell if your airway is one that's going to slide closed when you're leaning back. Okay, guys, we just want you to be healthy. We want you to stay and have a great life. So if you do have questions, don't ever hesitate to ask your doctor. That's what they're there for. Or if you have any other questions, you can always call the respiratory department there at the hospital. We're glad to answer any of your questions. You're welcome.